Very good evening to everyone on the meetup. My name is Jaco van den Heever, and I'm going to be speaking to you tonight about reimagining the patient experience. So this talk is based on many years of experience that I have working as a clinical UX designer or as a healthcare experience designer. And I'm going to start off just by telling you a little bit about myself. So I've got a background in informatics, which is basically a mix of IT and business. And I've also completed an MBA, and I've spent most of my career in UX design, and I've got quite a few UX certifications as well. I've worked for various companies across the world. I actually started my career at the London Fire Brigade, of all places, where I did some database administration. Then I moved to South Africa and I worked for a couple of companies there, Standard Bank, BSG, which is a consulting company. I worked for Vodafone in South Africa. And about 3 years ago, I started my own company doing consulting work called SinDollar Design. So in our consulting business, we focus a lot on healthcare and digital health. And on the side, I've also got a couple of health tech startups that I'm involved in. So my contact details are also on the page. If you want to send me a tweet or connect to me on LinkedIn, you're welcome to. So just quickly wanted to also talk about the health startups that I'm involved in. So the first one is Whole. Whole is a holistic wellness app that helps patients or people to actually look after and take ownership of their own health. And we don't only focus on physical health, but we actually look at all the aspects of holistic health, which also includes things like mental health, what impact your spiritual life can have on your health, what impact your environment has on your health. And also we take all this information and start building up an electronic health record that will be able to integrate into countries' health record systems once those things are up and running in various countries. The second startup that I'm involved in is My Blood Test. So My Blood Test is a South African health startup where we provide pathology services, so things like blood tests and urine tests, to the general public. So my understanding is that this is quite common in countries such as the US and the UK. But in South Africa, this has never been done digitally. And at the moment, you actually have to visit a general practitioner or a doctor first to get a referral. And once you've got a referral, then you need to go and visit your lab and provide your samples. And then you have to go back to the doctor to get your results. So all of this actually takes up a lot of time. It costs you money to go and see a doctor. So we're actually disrupting this whole market by providing a simple solution where patients can do it themselves. So I also want to speak a little bit about what my company SinDollar Design does. So it's our vision to change the healthcare landscape by reimagining the patient and the provider experience to help all of us achieve better health outcomes. We offer a unique service combining clinical experience with digital transformation as well as strategic experience design. And we do this by combining people with the skills in the area of focus, like medical doctors who help us to design better healthcare systems. And we get our UX strategists and leading designers to provide their input in terms of redesigning and reimagining this experience. And we follow a patient and provider-centric approach to deliver the best possible experience, but at the same time also to achieve the organizational goals of our clients. So in tonight's talk, I'm going to be giving you a little bit of background and context as to why it is so important that you need to improve and really reimagine the whole patient experience in healthcare. I also want to highlight the opportunity that exists within healthcare and how you can actually go about tackling that opportunity. And then I'm going to take you through a high-level proposed approach of how you as a healthcare organization, or if you're the team that's tackling the problem, can actually reimagine the patient experience. When it comes to experience, healthcare has really missed the boat. So I've worked across various industries such as financial services, insurance, fast-moving consumer goods, retail, e-commerce, and out of all of those different industries, I can definitely say that healthcare is far behind in terms of actually doing something about improving the experience. And that's both from a customer experience or a CX point of view, as well as a user experience point of view when it comes to designing good systems. So when you think about experience, you can use this model by Pine and Gilmour that was first published around 2010. And they spoke about the different economies or the different kind of revolutions in industry. So the first one was back in the day when you could actually create an advantage for your company by literally just getting access to the commodity. So by mining the iron or mining the gold, you were able to actually extract value and create value. But later on, other companies came and they started actually making stuff out of those different commodities. So they would turn the iron or the gold into artifacts, and that's what we call the industrial economy. Then once everyone started making stuff and manufacturing was quite common, the services economy started, and that's when people started saying, okay, so everyone can provide you with these goods now, but how can we actually make life easier? You can do that by providing services. And the last stage, which was identified around 2010, was what they call the experience economy. And this was when they said you could actually start differentiating your organization and creating value purely through the experience, through staging a differentiated experience for your customer. There's also another model which has now become quite popular, and we hear this term quite a lot in South Africa. Our government speaks a lot about this, and it's called the fourth industrial revolution. So quite similar to the previous model, but this is now kind of a new term that's become popular recently. And essentially, as you go through those same phases from kind of the industrial manufacturing, the assembly line to computing and internet, and now into the fourth industrial revolution. And what the fourth industrial revolution is focused on is to actually take all these new technologies that's available to us today, and through digitization and integration of all of these offerings to really start creating new value. And the fourth industrial revolution is fantastic, but it's still critical that you understand what the experience is that you actually want to improve by using these technologies, and how you're actually going to utilize the technologies to improve the experience, not just to implement these technologies for the sake of implementing technologies. And that's what we actually see quite a lot in digital transformation, is that a lot of companies have this mandate that they need to do digital transformation, but they don't really understand the underlying needs of the people that they're designing solutions for. So they think they can just kind of throw technology at the problems and it's automatically going to solve it. But experience design is still a crucial way to unlock the potential in these new technologies. So patient-centered care is quite a hot topic, and you can probably go to any healthcare organization and probably even lots of people outside of healthcare and ask them how important is it to be patient-centric, and everyone will tell you that it is critical, that it's super important. But unfortunately, not a lot of people that say that they are patient-centric actually understand what it really means and how you can actually start changing your organization and your systems to be more patient-centric. So there's a model that Picker defined, which is called the 8 Principles of Patient-Centered Care. And these principles are basically fast access to reliable health advice, effective treatment delivered by trusted professionals, continuity of care and smooth transitions in your experience, involvement in decisions and respect for your preferences as a patient, to have access to clear and comprehensible information and support for self-care. The next one is the involvement of and the support for your family and careers of those in the healthcare sector, emotional support, empathy and respect. And the last one is attention to physical and environmental needs. So true patient-centered care should actually encapsulate all of these elements. And these are great principles, but you still need to find a way to actually include all of these into your service offering as a healthcare provider. So how do you actually start embedding patient centricity into your people, into your processes, and into your systems? Because it's not enough to just tell people in your company that we need to be more patient-centric, or it's not enough to try and just bring in something like an app or a website and think that that's going to make you more patient-centric. You actually need to start changing the whole culture and mindset within your organization, and then start really actively putting patient-centric projects and solutions into place to ensure that you're being patient-centric. The next question I want to pose to you is that to improve the patient experience, should you only be patient-centric, patient-centered? So my personal opinion about this is that you can't only focus on the patient, but you should actually also focus on the other players in this value chain. And within the healthcare environment, you should also consider the provider staff. So that's typically people like your doctors, your nurses, the admin personnel, anyone that could be involved in this healthcare experience that you're providing to the patient. And when you're designing a solution, you should firstly actually think about what are their needs and what are their goals in order to actually give the patient a better experience and meet the patient's needs and goals as a secondary experience. So by focusing not only on the patient, but also the provider, you're much more likely to be creating a good experience. The other aspect about being provider-centric or designing for the staff is that you can actually create much more efficiency in processes, and by creating solutions that are more user-centric for the staff, you will probably get much happier staff, and they will actually enjoy using the solutions and therefore be more positive and happy when they're servicing the patients. So one of the most famous companies in the world that we could all probably agree is one of the best in terms of creating a user experience is Google. And the reason for that is because their mantra, their number one item in their philosophy is to focus on the user and all else will follow. So they've made it part of their DNA, and everything they actually do has to be tested against this philosophy. So what we recommend to create a much better patient experience as well as a provider staff experience is to follow a user-centered design process. A user-centered design process is a problem-solving process where you analyze and you envision the way that users consume your product or service. You include users throughout this process. So firstly, you think about the user needs. You actually do research with them to understand what they need, to understand their current pain points. And then you also validate your solutions through testing. So we go out and we actually take proposed solutions, whether it's a prototype or a final system, and you take it back to the users and you actually see whether they're able to use it. This is an iterative process, so it's not something that you just design once, you test once, and you launch it, but you actually go around in circles many times to first identify a need, come up with a proposed solution, validate it, and make improvements on that before you actually move ahead to the next phase. And following this process helps that you will actually proceed with the user at the center of your whole process and thinking. The last one is that you also try to balance the user needs and goals with those of the organization. Many people believe in this kind of myth around experience design that we as an industry are only focused on the users and we actually don't allow organizations to reach their goals. But a good user experience designer will actually understand the business needs and goals, or the needs and goals of the healthcare organization, and balance those out with the needs of the patients as well as the staff. And many times there are actually friction between those, and you have to make some decisions about which way you're going to go. And it's then very important to actually represent both the users as well as the staff, as well as the organization, to make sure that you're actually creating a holistic solution that suits all the different parties. There's a lot of benefits that's been identified over many years. I think it's about more than 3 decades now that the user-centered design approach has been followed across many industries. So these benefits include improved ease of use for products and services, to get much better adoption of products and services, to get better buy-in to change. So what we found is that by involving users as part of the process, or at least a representative number of users, you actually get much better buy-in across the board, especially when it's around organizational change and when you're changing systems for staff members. If they know that staff have been consulted and have actually actively participated in this process, they are much more likely to buy in and actually adopt this change. The next benefit is that user experience has been shown to really improve productivity. And by reimagining the way that processes and business rules actually work, we're able to really help uplift productivity and make people more efficient in what they do. The next benefit is better IT delivery. So because experience design people provide much better quality requirements than a typical IT approach where they give a lot of documentation and a lot of technical kind of requirements, we actually provide things like prototypes that illustrate exactly what the system should look like, how it should work. It's almost like a system without it being connected to an actual back end and doing all the complex logic and processing in the back. And when IT developers actually get that level of requirements, it's much less difficult for them to actually make mistakes. So it's much easier for them to actually follow the specifications. And with IT projects, there's a massive amount of projects that actually fail. So any way that you can improve the communication with your IT development team, between business and IT, is a big win for any organization. And lastly, a user-centered design approach has been shown to have a massive positive return on investment. So there's a couple of case studies where they've actually shown just by improving your IT delivery, you can actually save between 100% of the costs that you're investing into your IT delivery, and even up to 1,000% of your IT delivery if you look at the benefits after launching a solution and not having to fix issues once you've launched. So there is definitely a massive return on investment with experience design. So experience design really gives healthcare an opportunity to accelerate the way that they deliver experiences to their patients as well as to the provider staff. So there's a couple of ways that you as healthcare organizations can grasp this opportunity and accelerate and provide a better patient experience. The first one is to renew your thinking. So there's a lot of legacy processes and business rules currently embedded into a lot of organizations, including healthcare organizations. And when you start trying to improve the experience or start trying to bring in digital solutions, the first thing you should do is to literally question every single assumption about the current way that things work. So you need to rethink, should this process really work like this? Or is there actually a better way to do this? You should constantly ask yourself, why are we actually doing it in this way? What is the reason? And it could be that the reasons why things are working in a certain way might have actually disappeared over the years. Many times there's compliance or legislation or reasons like that which force you to have processes and business rules in place, but some of those things actually get taken away over the years. So it's really important to challenge the status quo and just ask, why are things done in a certain way? Because what you don't want to do is to go and create legacy problems, legacy processes, legacy business rules in your new digital solution. When you take stuff into a new solution with digital technology, you should really look at it almost from scratch and reimagine what this thing could actually be to provide the best possible experience. The next opportunity to accelerate can be taken by learning from other industries. So healthcare doesn't have to go through this 20-year process of becoming more mature in terms of IT, in terms of digital, and in terms of experience design. Industries like banking and telecommunications have paid a lot of school fees over the last 2 decades to improve on those things. But healthcare doesn't have to go through the same pains. They can actually learn from them and just start applying some of the learnings that have taken place there. Unfortunately, what I do see in a lot of healthcare organizations is that they are almost unwilling to understand the full impact that experience design and digital can have on their businesses. So it's almost like they want to start and go through the same journey and through the same pain points. But I think there's also opportunity to, for example, point people from industries like fintech and from e-commerce and from digital into healthcare organizations, and hopefully they will bring those learnings with them and help to accelerate those organizations. And the last opportunity is to embed user-centric practices within your organization. And by doing that, you will actually get people to change their mindset, to focus more on the users, the patients, the staff, and just come up with better solutions. But it's really a big mindset change, and it's really a big thing. So that's why it took other industries 20 years to get through this, is that they didn't want to put all these organizational changes in place, or they actually fought against it until the case for it was so strong that they could no longer fight it. And now what you see is that most of the banks all over the world have teams of hundreds, if not thousands, of designers actually being core in their businesses and helping to define how their businesses are operating now. So I don't know, if people in this forum are involved in healthcare, they could maybe help to accelerate that process by just learning from other industries, renewing their thinking, and starting to embed user-centric practices earlier in their organizations. So I'm going to take you through a couple of steps of how you can start embedding these user-centered processes in your organization. And this is kind of the 4 steps that we follow at a strategic level to get companies to actually understand their experience of their patients and their staff, and also how can they plan to improve that. So the first step is to ask yourself, where are you today? Who are your users? So by focusing not only on your patients or your customers, but also on your healthcare provider staff, and actually defining who they are. So who are your different patients? Do the different patient groups actually have different needs? Who are your different staff members and what are their different needs? How do they interact? what technologies do they currently use? Do they use mobile phones? Do they use computers? And if you understand your patients and your staff better, you can actually design solutions that's more tailored towards them. The next thing to ask is, what are their pain points? So what is currently the stuff that's really stopping them from being efficient? Or maybe with patients, what's stopping them from being your patients? Or when they are your patients, what are the worst things that are happening to them in terms of their experience? And it's critical that you actually base this picture of where you are today on user research. So user research is when you actually go out into the field and you conduct things like ethnographic studies, which is interviewing your patients, interviewing your staff, observing them and seeing what's going well, what's going wrong. And you can also do other types of research like surveys or focus groups, although in my opinion, ethnographic research is probably one of the best ways to do it. And by really spending time with the users, you typically get great insights into their pain points and into their needs. One of the tools that we use to communicate who your different users are user personas. So user persona is an archetype of a user that represents a group of users. So let's say, as an example, if you're looking at your staff, you in a healthcare organization could have nurses, administrative staff, and doctors. So you would then go and create a persona for your doctors, a persona for your nurses, and a persona for your admin staff. And then you are almost defining this kind of fake person, but that person actually represents this group of users. And with a persona, you try and create a picture of who your typical user is in terms of their demographic profile, what their motivations are, so what's driving them and what's blocking them from doing certain things. What are their goals and what are the typical tasks that they need to do within the context of your organization? And then also what their preferences are and their technology usage, maybe their educational level. And by putting all of those things into a nice visual representation, like what you see on the screen now, you're actually able to communicate to various people in your organization or maybe on the project who you're actually designing this for. And you'll be amazed how many companies never actively think about the different types of users that they serve and what makes each of these users different. So this is a very valuable tool just to help people actually get on the same page about who you're designing a solution for. Then another way that you can look at what your current state is or what's currently happening with your experience is to create a journey map. So a journey map is a map that tells you these are the different phases in the life cycle of a patient or of a staff member. So here's all the places in their life that they could actually interact with you as an organization. And here's the things that are working well. Here's the things that are not working well. Here's the ways that they are interacting with your organization or maybe with other organizations. And by mapping out this process, you can actually identify where are the key areas that you actually need to improve. So once you understand where you currently are, the next question is, where are you heading? So the idea here is that you should start coming up with a plan of how do you want to improve the experience of your patients and of the provider staff. And what you want to do here is to start creating a very clear picture of what the future can look like. So remember, this is kind of at a strategic level. So the idea isn't to actually go and build this necessarily. This is more to get people in your organization aligned to a vision of being more patient-centric and to start working towards that. So by painting a clear picture of what the future could look like for your patients and for your staff, you could use things like conceptual designs, prototypes, videos, and that helps to create a tangible vision that can really get your organization and your team to rally around and really understand where you're going as a company. So I'm going to show you a video of a future state that a healthcare provider in the USA did a couple of years ago. And this is a great example of what a future vision kind of state could look like. So that's a great idea to actually showcase to an organization what your vision is of where you want to go in the future. So when you're thinking about what your future as a healthcare organization can look like, it's also important to understand what the trends are that can actually impact on patient experience. So there's different trends to actually consider in this space. So the first one is regulatory reform. So what are the current laws and healthcare kind of associations, rules, and things that might actually change or that might relax to make it easier to provide a better patient experience? A good example of this could be telemedicine. So, for example, in South Africa, our Health Professions Council actually shut down a telehealth organization a couple of years ago because they felt that a doctor couldn't actually give someone a consultation without meeting them in person first. And I think now with Corona or COVID-19, they've actually become much more open to the possibility of using telemedicine. The next one is to understand the way that electronic health records and interoperability is actually enabling a better patient experience, and how a patient should be able to start actually utilizing their own health record across various organizations. The next trend is consumerism, and that's just understanding how the behavior and preferences of your patients will actually be changing, not just in the healthcare space, but across all industries. And with all of these trends, I'm not going to go through all of them. It's important to really understand how can they impact on your specific area of focus within healthcare, and that you can then start actually leveraging these changes to create a differentiated experience for your organization. So once you've got this vision of where you're going in the future and you understand where you're coming from or what your current experience is, you need to start plotting a way between the current and the future state. And that's what we call a roadmap. So the roadmap is typically something that stretches from 1 to 5 years. And you actually want to identify what are the projects and the initiatives and the small building blocks that you're going to start building in order to get you from your current state into your future state. And it's always great to identify things like quick wins, easy to implement solutions first, so that you can start building momentum. And the idea is also to break your roadmap into small pieces where you can start delivering value incrementally. So the idea isn't that you come up with lots of projects and programs that will all only start delivering value or going live within years, but actually break them down into small pieces. So if you follow things like agile delivery method, if it is an IT-driven solution, you can actually start shipping solutions within a very short space of time and creating value and actually measuring the success of those instead of waiting a very long time before you actually deliver a big piece of functionality. So think about how you can break stuff into small bite-sized chunks and start actually delivering value early in terms of creating a better experience. One of the ways that you can do this is to do some showcase projects. So it's not necessarily obvious to an organization that you have to get from your current state into your future state, and they're not all just going to release hundreds of millions of pounds or dollars into your budget to do that. So what you have to do is to start showing the value to them so that people can buy into it more. And that's what showcase projects are great for. So if there's a low-hanging fruit or something where you can start small and showcase some success by doing a proper experience design, implementing a great solution, and showing them how patient centricity is actually paying off, then you'll start getting more buy-in and you'll incrementally start increasing the funding for your experience improvement program. And the last phase of a patient and provider-centric strategy that I want to speak to you about today is metrics. So metrics is essentially how are you going to know whether you're being successful or not. And metrics focus both on organizational goals as well as user goals. So it's both the patient as well as the healthcare provider. And there's different types of metrics that you can use. So the first one is measuring things like productivity. So as an example, we did a project for a hospital group in South Africa, and we took the time for triaging a patient when they walk into the emergency room from an average of 25 minutes down to an average of 8 minutes. So that shows you that we actually saved something like 13 minutes in productivity by changing the way that the process and technology actually helps to fulfill the task of triage. So measuring productivity is a very good way of showing success. The next thing is to measure the experience. So measuring the experience can be done by different types of metrics and measurements. So there's different types like customer satisfaction, customer effort score, and the most popular one globally currently is Net Promoter Score. Each of these metrics has their own kind of flaws, but essentially if you have some kind of a metric that measures customer experience, you can actually use that to drive experience improvement. So for example, if you see in an emergency room that the Net Promoter Score for triage is low, but for doctors' consultations it's high, then you know you need to focus your attention on triage. And it's also vital when you start implementing solutions that you get an idea of what the experience is before and the experience is after you've implemented the solution, so that you can start measuring how successful you are. And then in the healthcare space, it's critical to actually measure the outcomes. So in healthcare, it's all about the care that you actually provide, saving lives and making a difference to people. So these are actually the most important measures when it comes to measuring success. Even for experience, it is vital to actually improve the outcomes in healthcare. And the great thing is that it's been proven that providing a better experience on systems like electronic health records do actually lead to better outcomes. So design used to be the seasoning you'd sprinkle on for taste, and now it's the flour that you need at the start of the recipe. That's what a famous designer called Maeda said. And I really agree with this. Design has become an essential part of most successful organizations in the current era. So in summary, healthcare is definitely behind in terms of providing a great experience to their patients as well as to their staff, but there's a great opportunity that exists to accelerate and actually overtake some of the other industries and accelerate the improvement of experience. By utilizing the proven processes of user-centered design and following a strategic approach, you can really reimagine the patient and the provider experience and make a big impact on healthcare. Thank you very much for your time tonight. And if you want to get in touch with me, my contact details are there on the screen. And I look forward to talking a little bit more during the panel discussion later.
We're just going to go to the Q&A. So if anybody has questions, please do throw them over. Curious to know, Giles and Vanetta, what did you think of that? And do you have any questions?
Yeah, I thought it was a really, really good talk. I know Jaco for a few years, so I know his mindset with this is a wonderful contribution actually to the healthcare UX industry. It's great to have him as part of the Q&A here today. So from my side, definitely I've got a question. Actually, I'm quite keen to know from your perspective, considering you've got an eye on what's going on. Have you actually seen any particular companies or particular healthcare providers that are demonstrating really, really good digital patient experience?
So to be honest, I haven't really seen a lot of exceptional experiences in South Africa specifically coming up in response to COVID when you're thinking about digital. I think because it's kind of snuck up on a lot of the providers, they were scrambling just to get almost some minimum basic stuff together. So what we've seen is kind of slapdash solutions kind of being put out, but you can now start seeing some of them actually being improved and iterated on. But some of the initial ones were pretty shocking, to be honest.
Yeah, I think it's a similar thing that I've kind of noticed. It's quite hard to find companies that are really excelling. Like if you're going to go to financial services, fintech industry, they take it very seriously. You go into e-commerce, they take customer experience very seriously. But when it's down to patients, unless it's actually patient care, you're getting these inconsistencies in the actual quality of what these patients are going to get from a digital side of things. And I think it's mainly, as you highlighted before, that it's just not really well understood. The maturity of UX in healthcare is so low that we don't have even enough examples of best practice within healthcare for us to be like, let's copy. There will be more like saying, oh, let's try and be the Apple or the Google for healthcare. They can't refer to another healthcare company and saying that this is the benchmark, this is the standard that we should be striving for that's already existing in healthcare. So it's quite frustrating for me as a clinical UX designer, but I'm hoping that things will get better as the years go by.
The one industry that was actually kind of ready, or the one technology, is probably telehealth. And I think telehealth wasn't like massively successful before this COVID crisis happened. But now all of a sudden they've been propelled into being the solution for a lot of the ways to deliver healthcare without actually having physical contact. So it's almost the solution that was previously identified for a need that didn't exist yet, or maybe existed in a much smaller scale. And now all of a sudden that is a perfect solution for COVID. But now it's the regulatory aspects that are actually kind of stopping it from also really fulfilling the potential. So, for example, in South Africa, they in previous years actually stopped telehealth from operating because they said patients cannot be seen by a doctor without them actually having established physical contact first, which is actually ridiculous thinking about it. But that's the reality in our context.
No, it's quite frustrating that, like as you highlighted, telehealth has been out for years, and it's very, very simple technology. Like even before it became a thing where you're using videos, you just call up your doctor. I'm sure you've done it as well. You just call up your doctor, speak to them on the phone, just to see what's going on, or you need to do a prescription, you just need to discuss some symptoms, and they can give their advice on the phone. So I don't know why it's had to take a pandemic for us to see that technology can actually help. But
Precisely. Yeah, very good. We have a couple of questions as well on the comment section on the YouTube stream. The first one from Olga is, and I don't know if you've answered this sort of inadvertently, but is the app private healthcare only or for anyone?
So the holistic wellness app is aimed at both private and public in the long run. So the idea is that we would have a kind of a commercial version of it available for people to subscribe to. But we actually also feel that we want to make it available for free to the general public. And the concept is that it would integrate with kind of national health systems so that even for the poor man on the street, that they could still actually get access to world-class healthcare that's holistic. And it doesn't mean they have to get access to all the expensive medicines and things. They could actually, just by being more aware of the other aspects that impact on their health, start managing their own healthcare much better. So definitely both for public and private consumers.
Cool. We've had a few others as well. One is from Yvonne. She said, thanks for the talk. It was really, really good. What, if any, differences in approach do you advise for B2B focused products compared to B2C?
So in terms of the approach, when you're designing the solutions, I would actually recommend following the same approach in terms of how you approach a problem, which is the user-centered design approach, which I spoke about. So it's still relevant. It doesn't actually matter whether it's B2B or B2C. You should still start off by doing research to understand who the users are going to be, and do prototypes and validate the products that you've designed with actual users by testing it. So I would definitely say follow the same process at a high level. Obviously, what you come up with will be quite different.
Sure. Another question from Asim. He is based in India. He said the healthcare system here in India is extremely overworked in times of Corona. How can a design student approach healthcare providers in these times to really get their perspective?
Yes, so that's a tough one. So what we found is because the maturity in terms of digital health is quite low with a lot of healthcare providers, for them just realizing that they actually need design as a kind of component of their delivery model is a big step. So that's why we actually do events like these to try and actually educate people and make them aware that they need to start considering this design thinking approach and start bringing digital technologies into the way they deliver their services. But with any kind of problem like this, I would say, start small. Maybe he's got a local healthcare provider close to him where he can get involved, and even at a small scale, start making a difference and help them come up with some small solutions to their problems. But by still following the correct user-centered design approach, he can then start honing his skills in the field.
Yeah, I'd like to add to that actually is some practical advice to build on that is it's quite hard to reach out to healthcare professionals because of their work-life balance. They're just so overworked. Coming from a healthcare background myself, like it's very easy to be on the wards for 12 hours and you're not wanting to talk to some designer that is hoping to save the world and probably has the skills to make a huge difference. So actually, you want to see where can you go where they will already be and excited to start talking to you. So go to other digital healthcare events. At the moment, it will be online, but when we are back to somewhat normality, being able to meet up in person, try and go to these events, ask questions. When you ask a question, you get noticed. So when you ask a question, you introduce yourself, you make it clear your intentions. Some of these doctors will come to you. Also, try and actually go to find students who are in the healthcare sector. So medical students, nursing students, physiotherapists, other type of therapists. Speak to them, because there's a lot of them, particularly those that are studying now, who are really, really invested into involving digital health into their way of providing care. They don't just want to be face-to-face clinical providers. They want to actually use digital as well. So if you can partner up with them, they will be the gateway to reaching practicing healthcare professionals as well. So I found that's been quite useful, both as my time as a doctor, how people would approach me, but also on the other side now working in UX. Actually, if I wanted to find out more of the issues, I'll try and go to these clinicians in environments that they're already congregating in, or reach out to students.
Excellent response. Yeah, very good. And hopefully that's helpful to Asim. I'm sure if you have any other questions, Jaco or Giles might be happy to just answer in the comments for you. We're going to get over to the next talk shortly, but I'll just try and fit in one more question, which was from Whale. I hope I've said that correctly. He said, is this a traditional app or web-based? Also, how do you hope to capture users of feature phones?
Okay, so it's actually an iOS and Android app. So we've decided not to go for the web-based app because our first kind of MVP version is actually targeting premium users that's willing to pay for it. And then the second iteration, once we've done that round successfully, we'll start looking at how do we make it more accessible to lower income kind of users. So later on, we'll definitely consider things like web app, websites. Feature phones are actually still around, but the projections are that in the next 2 to 3 years, the majority of users, even in very poor countries, will actually be using smartphones.